Hi, everyone. This is Yaboa Normant from Pearls for MPs. Today on Highlighting the MP, we're going to discuss the role as a clinical nurse faculty instructor. So today I have Dr. Ashley Anderson all today. Thank you for joining us. Dr. Anderson has been a clinical nurse faculty instructor for over 1 year teaching RN students. So welcome, Dr. Anderson.
Thank you, Karen. It's my pleasure as well to join and be of any help that I can to our listeners.
Hey, thanks. So what made you decide to become a clinical nursing instructor?
I believe my interest sparked as a staff nurse. I worked in the beginning of my nursing career, I worked on a med-surg ortho floor. And after a few years, I became a preceptor for many new nurses. And then I really started enjoying it, being able to give back my knowledge, my expertise, and even just more about how we should compose ourselves as nurses, how we should draw from our well of compassion and empathy and those things. So it definitely made me have that interest that, oh, I definitely want to do some type of more nursing education.
And I would definitely say you've been a great influence in my life. When I started mental health, I remember texting you with questions. So thank you for always being there for me. So great. How can you tell me what settings you work at as a clinical nurse instructor?
Yeah, so I've done community health, mental health, clinical, and then collaborative healthcare, which is like a course, depending on the institution, it's the second to last course for a lot of senior nursing students, where we kind of talk a lot more about delegating and prioritizing. So I've done those settings so far.
And what's your schedule like as a clinical nurse instructor?
So since I work part-time currently as a clinical nurse instructor, I work once a week, and we visit I visit the clinical sites with the students. When it was community health, we went to vaccination clinics, schools, food banks. We even did a detox center as well for medication addiction treatment for I believe there was 2 different sites that we went to. So with those schedules, we're visiting those places because we're not in the traditional hospital unit. They can vary from 6 to 8 hours. Like I said, but depending on the institution and the actual course. But I would say around 6 to 8 hours once a week as part-time.
As part-time.
Yeah.
And what are you working at a university, at a community college, at a nursing school? Can you elaborate what settings you work in currently?
Yeah, so I've actually done all three at a university level, Rutgers University, and Chamberlain College of Nursing or School of Nursing, and then Mercer County College. So it's 3 different types of schools because the university level are BSN students, and then with Chamberlain, it's RN, so they also have BSN as well. But then the county college is just the RN associate level.
Nice. So community colleges is great. That's awesome. Tell me, do you need a DMP to become a clinical nursing instructor?
So you don't need a DMP, depending on what level you want to teach, because doing the RN students, either the BSN students, the associate level, you don't need a DMP. If you want to teach at a level of teaching other doctorate prepared or doctorate prepared DMP programs, excuse me, then you would need a doctorate. But I believe master's level, you do need a master's degree to teach that type of level. But where I'm at now, you don't need a doctorate degree.
That's good to know. So just to echo on that, I remember 5 years ago, I worked as a clinical nursing instructor for LPN students at Lincoln Tech. So I used in nursing. The DMP is for more if you want to, teach, I guess, nurse practitioner students at like a state university, correct?
Yes, yeah, exactly. Yeah, then they do prefer that. And even with some of the online MSN programs, nurse practitioner programs, even just a master's degree is sufficient because I've seen a lot of that on the job requirements. But I believe maybe at the university level with doctorate students, they would probably prefer DMP. And then also I'll add that, with the DMP, if you're looking into like nursing leadership or wanting to be like the dean of a school of nursing, then that would be the route to go as well.
Okay, good to know.
Yeah.
So as a nurse practitioner, where are you currently? What are your other roles as a nurse practitioner?
Yeah, so I work full time as a psychiatric mental health nurse practitioner at a private mental health treatment center. We're a pretty small group right now of one of two NPs. Then we have a few therapists, and I've been working with this particular private practice for about like a year and a half. And I enjoy it. Seeing patients. I work from home, so I have that advantage. And then with the part-time teaching, that's typically in person. So I do have that little balance of being outside the home, seeing students, but then full-time I am seeing patients through telehealth.
Nice. So what day of the week do you usually work as a clinical instructor? Is it on
So
weekdays?
yeah, weekday. I love my weekends. So I haven't committed to any like Saturday. Because typically like it's very seasonal. Since I mentioned those three schools, I'm not working at them like all at once. It depends on what class they have to offer. And the other two, unlike Rutgers, are not like that traditional 12-week semester. So it is a little different. So I have been doing weekday. I believe at one point I've done Wednesdays. Now I do Thursdays. So on Thursdays, I don't work at my full time. I have that day open and I just, make up my required full-time hours the other 4 days of the week. And then, weekends I'm off.
Okay, good. Good to know.
Yeah.
Cool.
Mm-hmm.
And then my final question is, what advice do you usually give nursing students?
So I always tell them, do your best and be your best. Don't be so hard on yourself with exams. And because we know how it is, you have to score a certain percentage. If you get below this number, it's like, okay, you feel panicky, like, oh, am I going to pass the class? But, God always prevails. I'm a believer, I'm a follower of Christ. So I really hold on to my faith very dearly to get me through the challenging different times. So, and in general with nursing, I feel like when I tell students, do your best, be your best, it goes even just beyond the classroom, just even, at clinical with the patients you meet, with all the different qualities you want to work on as a person, because that will also transcend into your nursing career, that compassion and that empathy and being patient and all of that. So I try to give that advice about those qualities, because all the different skills, you will learn as you go through your nursing career, but you want to really hone in on that other, those qualities that make patients like never forget you. So I try to give them that advice and I give them my support too, like I'm here during the courses, even if I'm not your clinical instructor, I'm still here. Here's my email, here's my number. And then also when you're done, you can use me as a reference. Let me know. I can write a recommendation letter. And then I've had students, update me. They pass the NCLEX and all those things, and they're working. So it's very nice. It's very rewarding.
Oh, sounds like you're a great instructor. I'm sure your students are blessed to have you. Oh, yeah, I did forget to ask you, what's like when you're at clinical, what's your day-to-day like with the students? Can you elaborate on that?
Yeah, sure. So we always have that scheduled time we meet. For when I recently did Chamberlain, that was virtual. So it was a little bit different because although it was early at 7 a.m., I would start off asking them what they learned in their lecture, Do they want to share any challenges? Kind of like a little venting in a way too, so that they could clear their mind and be open to receive the, scenario and role playing that we would do. In the in-person phase, that was also different because we would do that. Even on virtual, we would always do our pre-briefing and then post-briefing or post-conference, and kind of reflect more on, what did you learn that you didn't know, what helped to enhance even what you're learning in lecture. And then throughout the clinical day, because I haven't done a traditional hospital setting, it's a little different, like community health. When we visited a school, actually had the students split up in like 2 schools that were like across the street from each other. And these are all provided by the course leader, like the sites. And they would help the school nurse with different tasks that they had to do. And then I'll go back and forth to both schools to observe them, answer any questions, and then we would have, that post-conference as well, and talk about the experience. So it varies. Mental health, I'm actually like about to start now with this mental health clinical, so I'm excited to see how it will go. Since that is my specialty, I think I'm more excited about that because I know maybe what to expect, even though, it's inpatient, but I worked inpatient as well as a psych nurse some time back. So I'm a little bit excited to see how is it going to be, but the same routine and structure still applies, pre-briefing and then that post-conference.
Nice. So, are you teaching now? Do you have a break now?
Yeah, so now I'm about to start again. And then I will have a little break in December. I'm hoping to start January. I haven't had the confirmation yet, so we'll see. It depends, but I'm still open to working at different schools. And that's one thing you can do. You can work at different schools because a lot of times they don't overlap if it's not like all universities. If some of them are just like program, diploma programs, or county colleges, it may be different than the university level. But if you do multiple universities, it may overlap unless you're open to doing more than once a day in the week, to make up, and do 2 schools at once.
Good to know. Yeah, I gotta look into that.
Mm-hmm.
I did teach 5 years ago. I would like to go back to teaching. So good to know.
Yeah, and you would be great. You would be great. Yeah.
Thank you. Well, thank you so much, Dr. Anderson, for joining us today on highlighting the MP. We had a great discussion today. Again, you've been an asset to the nursing field. We need more nursing faculty instructors like you. So definitely want to go and become a nurse faculty instructor. I would say go for it. Thank you. Thank you again.
Of course. Thank you for having me, and feel free. Karen can provide my contact info if you have any further questions. I'm glad to help.
Oh, thank you. Thank you. Bye.
Bye. Thank you.